Physical assessment of the mouth, throat, nose, and sinuses. So, definition. An evaluation of general condition of the patient, mouth, throat, nose, and sinuses, and of factors or abnormalities that may be contribute to the present condition of the mouth, throat, nose, and sinuses. So, purpose to provide as a nurse and doctor the opportunity to collect information about the condition of the patient, mouth, throat, nose, and sinuses. So, what are the equipment? So, the equipment are gloves, examine light, cotton gauze pad, pen light, speculum attached to otoscope, and tongue depressor. So, general consideration number 1. Be able to identify and understand the relationship of the structure of the mouth, throat, nose, and sinuses. So next, number 2 is know age-related changes of the oral cavity, nasal, and sinuses structure. So number 3 is be aware of the ethnocultural phenomena related to the oral and nasal health. So lastly is to refine examination techniques. So next will be the before the test. Gather the equipment, explain the procedure. Lastly, ask the client to gown. Suggested action, normal findings and abnormal findings. So, mouth assessment. Number 1, note for any distinctive odor. So, normal findings. No usual or odor is noted. So, abnormal findings, fruity or acetone breath, and fecal breath odor is an abnormal finding. So, number 2, inspect and palpate for letter A, lips. So, normal findings. Lips are moist and smooth without lesion or swelling. So, pink lips are normal in light skin, and bluish and freckled is normal in dark skin client. So, abnormal finding of the lips. Pallor around the lips, reddish lips, and swelling of the lips. Letter B, buccal mucosa. So, normal findings appear in pink light skin, client, tissue pigmentation, typically increase in dark skin client. So, in both tissue are smooth and moist without lesion. So, next will be the Stenson ducts are visible with the flow of saliva and no redness, swelling, pain, or moistness in the area. So, abnormal findings, whitish card-like patches that scrape off over redness mucosa that bleeds easily. Canker sores seen as brown patch inside the cheeks. So, letter C, teeth. So, 32 pearly whitish teeth and with smooth surface and edges, no repaired or decay, no missing teeth or appliances. So, abnormal findings, yellow or brownish teeth, no missing teeth, malocclusion of the teeth. So, letter D, gums. So, normal findings, gum should moist, pink, and firm with tight margin to the tooth, no lesion or masses. So, abnormal findings, receding gums, red, swollen gums that easily bleed, and bluish black or gray white line along the gum line. So, letter E, tongue. So, abnormal findings. Pink, moist, moderate size with papillae or little protuberance is present. And no swelling, redness or pain, no lesion, ulcer, or nodule are apparent. So, abnormal findings. Deep longitude fissures or dehydration, a very black tongue is indicated as bismuth, a very small tongue, and an atrophied tongue. So next will be the throat assessment. So number 1, inspect for the color. Inspect the throat color, consistency, torus, palatinus, ovula, singularities. So normal findings, throat is normally pink without exudate or lesion. So ovula is a freely solid structure and normally hang in the midline. So no redness or exudate for ram ovula or so palpate. Midline evaluation of uvula and symmetric evaluation of the soap palate. So, abdominal findings, a bright red throat with white or yellow exudate, on yellowish mucus on throat is present. A defined uvula that looks like it's split in two or partially severed. So number 2, inspect for the tonsil, color, consistency, and grading scale for 1 plus, 2 plus, and 3 plus, 4 plus. So normal findings, tonsil are maybe present or absent. They are normally pink and symmetrically and may be enlarged in 1 plus in healthy client. And no exudate, swelling or lesion is present. So, abdominal findings. Tonsil are red and enlarged to 2 plus, 3 plus, and 4 plus. It is covered with exudate in tonsillitis. They are also maybe be injured with patches of white or yellow exudate. Nose assessment. Number 1, inspect and palpate the external nose of the color, shape, consistency, tenderness, and patency of airflow. So normal findings. Color is the same as the face and nasal structure is smooth and symmetric and no tenderness. The client is able to sniff through each nostril while the other is occluded. So, nasal tenderness on palpation. Client cannot sniff through a nostril that is not occluded, nor can he or she sniff through blow air through the nostril. Number 2, inspect the internal nose for color, swelling, exudate, bleeding, ulcer, perforation, septum, or polyps. So, normal findings. The nasal mucosa is moist and free from exudate. The nasal septum is intact and no ulcer or perforation. Turbulence is dark pink, moist, and free from lesion. So, abdominal findings. The nasal mucosa are pale or gray. There is the presence of the lesion. So, sinus assessment. Number 1, palpate the sinuses for tenderness. So, normal findings. The frontal and maxillary sinuses are no non-tenderness to palpate, and no cryptus is evident. So, abnormal findings. Frontal and maxillary sinuses are tender to palpate. So, number 2, percuss and transluminate. The sinus for air viruses, fluid, and pus. So, normal findings. The sinus are not tender on percussion. So, a red glow transilluminate. That's the frontal sinus. This indicate a normal air-filled or sinus. So, abnormal findings. Absence of a red glow upon transillumination. So, today, sir, hello, sir. I am Alba de los Santos from Holy Trinity University. Bachelor in Science in Nursing. So, today, sir, I'll assess your mouth assessment. So, first, sir, do you have any braces, pustiso, or anything like that?
Wala.
So, first, I will inspect, say, ah.
Ah.
Okay, next, I will inspect and palpate your lips, buccal mucosa, teeth, and gums, and tongue. So, first, I'll say lips. Next will be the buccal mucosa. So, ah. And also, I'll check. So, next will be the teeth. Ah. Okay. And then the gum. So, next will be the tongue. Okay. So, next will be the throat assessment. So, first I'll inspect the throat for color, consistency, torus, palatinus, uvula, singular. Then, say ah. Yan. Next will be the inspect for the tones or color consistency grading scale. So, ah, ah. Okay. So, hello. I am Alba de los Santos from Holy Trinity University and nursing student. So, today I will assess your nose and sinuses. So, first, I will inspect and palpate the internal nose for color, shape, consistency, tenderness, and patency of airflow. So, ganito na. This is the blow sa kabila. Yan. Yan. Next, I will see your nose. Titignan ko ito na. So, next, I'll inspect the internal nose po. Internal nose for swelling, exudate bleeding, ulcer, or perforated septum or polypses. So, next will be the sinus assessment. So, I'll palpate the sinus for tenderness. So, masakit. So, next is percussion and transmission, the sinus for air, viruses, and fluid or pus. So, up and down. So, after the test, number 1, formulate nursing diagnosis, wellness, rest, and actual. Number 2 is formulate collaboration problems. And number 3, make necessary referrals.